morning, y'all. Where the cash at? Listen, thank you so much for having us today. Some of our other colleagues are here from the Kresge Foundation, and we are so excited about the progress and the movement of the cash movement here in this country, and we are committed to it, invested in it, and really happy to be here for this celebration. So I wanted to start off really briefly. I have the opportunity to introduce two amazing women. But I wanted you to know that I don't know who here is from Flint, but it's so special to be here today as a person who was born and raised in Flint and come from a multi-generational family. Flintstones in a house, yes. Come from a multi-generational family. And my mom had me when she was in high school. And she graduated with a 3.9. And I live in a multi-generational family with my mom and my grandparents maternal until I was 8 years old. So I know what it is to struggle, and I know what it is to struggle less. I know what it is to be a parent on WIC, need childcare, have your lights not come on, and tell your kids that I'm not sure why they're not coming on. And so that's the fact. So there's not distance between me and you and others in this room who you may not even know their story. We have a lot in common. And at the Kresge Foundation, we are committed to this, and we are quite frustrated with the inequity that's happening in this country. And we recognize that we have a root cause systems problem in America, and we have known what to do about it. So we're going to continue to agitate, create the tension until we get it together in this country and recognize that we all matter. And so thank you so much for having me to do this introduction. Well, first, let me tell y'all something. I have the pleasure to introduce two amazing women, and the first lady I'm going to introduce is Professor Melissa Harris Perry. So, Melissa Harris Perry, she is a professor, she is a writer, a political commentator, an advocate, and she just taught me a little class on environment and land and power and race just in the green room. So she is off the hook, and she is unapologetic, beautiful, gracious, and authentic. Please join me in welcoming her to the stage. Melissa Harris Perry. Now, this next lady really doesn't need an introduction, but let me tell you something. I feel like I've been knowing Dr. Mona forever. And I like her even more now because I know she went to Michigan, just saying. So we've been in thought partnership, me, her, Luke, and one of my colleagues at Kresge, Gina, who's also from Flint, for about a year now. And just learning so much about this work. And so excited that the Flint community gets the opportunity to have this type of resource. And so Dr. Mona, I don't think she sleeps. I don't. And I don't think she has an iron deficiency either. And she's a pediatrician. She is a scientist. She is an activist. And she doesn't know this. My new nickname for her is the mother of RxKids. So join me in welcoming mother of RxKids, Flintstone cousin, Dr. Mona.
Dr. Mona.
Hey everybody. It's great to be here.
It is so great to be with you. I want to start by talking about the fact that we are here. We're located, we're in this place. And I feel like there's, being someone who lived in post-Katrina New Orleans for a decade, I feel like many of us live in places or have experienced a place being something that either people don't think about at all, and then the first time that or they think about it in one way, and then the first time it really comes into their consciousness is around some notion of disaster or failure. And then that thing is the thing that marks your place, right? So we're 2 decades post-Katrina now. So now you say New Orleans, people don't think Katrina. And we're nearly a decade post, or in the context of water crisis. And yet, Flint still carries that. So I want to start by just inviting you to tell me about your Flint.
Oh, thank you for that, and thank you for the opportunity to be here with all of you. This is a wonderful convening. So we're the Flint kids. I know there's got to be Flint kids in the audience. Yeah, there's always Flint kids. Amazing. So I think when most people think of Flint now, they think of brown water, right? Do you guys remember those pictures of brown water, kids with rashes? I think when people think about Flint, they think of one of the most egregious environmental and public health crises of our time. They think of government neglect. They think of a whole city abandoned, neglected, poisoned by literally their own government. So I think that's what a lot of people think. But I think for me and for many of us on the ground, there is a different story to tell. And that is why I'm so excited to be here and to share with you the different story that we have been writing from day one. It has been our community's commitment from really the onset of the water crisis, even before the water crisis, to share a vision of how best to care for each other, to build kind of this model of resistance, of disruption, of hope, and of community. And that is the Flint that I want to share. Not a Flint that is marked by a crisis, but really a Flint that I want you to remember about what we did next, how we were able to kind of change that narrative. And I think we've been successful.
I want to stay a decade past for just one more moment.
I wish my age could stay a decade past.
I know, right? Listen. I walked into the hotel room last night and they had it quite cold in there, and mostly I was excited to discover I could still be cold.
I hear you.
Oh, level 5. Okay. The men are like, what? Sorry. Okay. But I do want to stay a decade past for a moment. Because I'm
in my 30s.
Yeah, right. As I said, when I walked in to the green room, I teach you, right? So not so much that I teach the book, but I teach you. And I teach you in the context of my environmental justice class, right? Because we start with usually a bunch of really wonderful, brilliant, but privileged environmental students who would come to class. I'd give them sort of a reading on the water crisis, and I'd say, okay, what broke this open? What shifted this? And always the response is Virginia Tech. The Virginia Tech scientists, they came and they brought scientific evidence, and that was the thing that shifted and changed and made possible change. And then I teach Dr. Mona. And I ask, who is it who gets to be a scientist? Who is it who gets to have knowledge? What happens when we're thinking about any of these questions of solutions to even who gets to identify problems? So I want to start there, in part also because, just to bring the book in for a moment, you do talk about your own mother being a trained chemist. And then I think the sentence is something like, but her foreign education meant nothing in this space. And so I kept thinking of whose knowledge means something in the policymaking space.
That's a great question. And, I was in Flint and having the privilege of, to this day, caring for our children and was able to do the science to see what was happening to our kids. And I had the privilege of wearing a long white coat, which meant I was a doctor and I had a bunch of degrees after my name. And I had the ability to kind of raise my voice, and eventually it took a while for people to listen. And I recognized that I was in this privileged space to be able to do that. But it wasn't my voice that was first, and it wasn't the Virginia Tech's voices that was first. It was the people of Flint's voice that was first. For a year and a half, the people of Flint were saying, hey, there is something wrong with my children. My water is brownish and greenish. It smells weird. My kids are getting rashes. They were loud and they were brave and they were organized. And they were being dismissed and denied at every turn. And that is why this is a story of an environmental injustice. But it's also a story, and we had the joy of talking about this earlier, it's also the story of what happens when we take away democracy. When we don't have seats at the table for residents and usually people of color and vulnerable populations. Flint and Detroit at one time were under this bizarre state of financial emergency management. And this was happening all over the state of Michigan, so much so that 50% of our Black population in Michigan was under emergency manager control compared to 2% of our white population. So grossly undemocratic, unjust. And these folks were making decisions driven by austerity, about saving money, and that's how our water source was changed. So it was in this So because of that bizarre state of usurped democracy, people weren't being heard. People weren't being listened to. And they were unable to break through, even though they were being loud and organized. And then I got up there once again with science and facts and a white coat and as a credible physician, and finally things started to change. It shouldn't have been that way. The water crisis should have ended when the first mama raised her hand and said something is wrong. So that is why the work that we are doing now and the work that we have been doing since is done in humble, hand-to-hand partnership with our community. Our story was about democracy taken away. We are leading with participatory democracy. We are leading with self-determination. RxKids, the nation's first universal maternal and infant cash prescription program, was designed and conceived by our mamas. You just saw Tegan. Tegan was part of our planning when this was just an idea. So that has been deliberate in this work. But because we had that injustice of losing kind of our democracy, but not a unique story. And that's what I want to reiterate. This is not a crazy thing that happened to Flint where people's voices weren't listened to. This is something that continues to happen all over, and predominantly in low-income and minority communities.
So you made exactly the bridge I wanted us to make, because that language of emergency financial management feels to me like precisely how public policy towards people living in poverty exists, right? Oh, we will come in and we will emergency financially manage you. This is how much you can spend on housing. This is how much you can spend on food. This is how much you can spend on childcare. These are how many hours you need to work, right? Like this same notion. So to move towards guaranteed income, and this is Aisha Yanduro asking that question, how much does a gallon of milk cost? And the idea that people who don't know the answer are telling folks who know how much a gallon of milk costs at all 4 stores in their neighborhood, right, how to spend their money. I ain't really been right since you asked me that question. So to move to guaranteed income, you have to move to a belief that moms, pregnant people, people living in poverty, people living with bodies that can reproduce, might know how to spend the money that you hand them, that they are the scientists, that they are the data, that they are the researchers. So how do you move there? How do you move policymakers there?
For a year and a half that the water crisis was happening, I was a practicing pediatrician, and the moms were coming to clinic and saying, something's wrong, I don't think the water is right. And for a year and a half, I was telling my patients that everything was okay. And so I kind of violated what we consider in pediatrics as like Mom 101, like Pediatrics 101 is like moms are always right. Moms know what is best for their kids and their families. And I think this is driven by that same philosophy. Our moms know what is best. They have known what is best for decades, if not centuries. The fact that we have built this kind of paternalistic, patriarchal society that tells and governs and tries to control our mothers and families is wrong, and it doesn't work. And I think the reason that we have been able to shape policy is because this is also very much driven on science. The unconditional cash transfers, especially in that critical prenatal infancy window, which RxKids is. It's a one-time prenatal cash prescription in mid-pregnancy at $1,500. It's a lump sum, and then it's $500 a month for the first month of life. This window, this prenatal infancy window, is the most economically vulnerable time in the life course. People are poorest at childbirth, which is like maddening. Like it's crazy. Like moms lose income towards the end of pregnancy because they have to come out of the workforce. Babies are expensive. They need stuff that persists for the first year of life. And when I first learned that families are poorest at childbirth, like I literally wanted to pull out my hair because like as a pediatrician, that is the most critical window of life. Like your brain doubles in size in the first year of life. Like what happens in that window shapes your entire life course. And if we can surround families and babies with goodness during that time, we can really prevent kind of lifelong adversity and health impacts. So we share that science with policymakers. We share that this window, what we do in this window has a massive return on investment later on. We also share with resistant policymakers when they were like, well, why can't you control what people are spending? We also share that if we added any kind of administrative burden, if we have to do any policing of who's spending what and any means testing, this is a universal program. There's no means testing. Figuring out who's in, figuring out who's out, that also costs more money. So to have a program that is universal, unconditional, is a more efficient program. It is more of an effective program. But more importantly, it is sharing some really, really powerful messages. So our work is about health equity. It's about bolstering family financial security and empowering our mamas and our families. But it's also about changing the narrative. It is about dignity. This is for everybody because this is sending a message that this is how we are supposed to care for each other, with trust and with agency and with autonomy and with freedom and choice, which also resonates with different political spectrums. So these are the messages that this program is conveying, and that has seemed to resonate with lots of different folks.
All right, on this resonating with lots of different folks, I want to dig down into the strategy a little bit because, I mean, I'm a political scientist who is still also like Gen X, really a believer in the whole American project and self-governance kind of thing, right? Okay. Can't help myself. I do sing America, all that. Okay. But being Gen X, I'm also pretty strategic, right? So we're the, no permanent friends, no permanent enemies, only permanent interests, kinds of people. Which is maybe different than my Gen Z daughter who's like, if you are not ideologically aligned on all the things, stay away from my coalition, right? Okay. So to make a universal program in these spaces, right, you're going to have to make different kinds of arguments. And as much as I'd like to believe that all policymakers will look at a good graph and some data and empirical evidence and then move forward with policy that makes sense. Okay. So talk to me about how you're actually able to move TANF dollars here, which is striking, and also how this horrifying moment around the restriction of reproductive justice might also, nonetheless, simultaneously, be a moment for advancing this with some groups who are not our permanent friends, but who might be able to advance some of our permanent interests.
That's a great question. And I think what I have learned in my advocacy work since the water crisis, trying to kind of lead the recovery and get our pipes replaced and kind of get the Infrastructure Act passed, so doing all this policy work, I have learned that I need to make friends with everybody, that my constituency is children, and I will talk to whomever, wherever, about what kids need. So as a pediatrician, my work is nonpartisan. It's just about what kids need. And I have also learned that as much as I can bore people with science and graphs, and I love graphs and charts.
She totally whipped out an actual graph.
Back in the green room, we were looking at graphs. But I have to have stories in my pocket. This work does not move without our ability to share the human interest stories. During the Flint water crisis, the Flint bill was stuck in Congress to replace our pipes for about a year and a half, until I met with a Republican legislator and shared stories about kind of how people were living, how they were giving their babies baths in water bottles, and got his chief of staff to start crying, and then became a co-sponsor of our bill. So when you get people to cry, cry, like it's a win. So we share a lot of stories. We share a lot of stories in this work. And the beauty of RxKids is we're sharing stories about babies. Right? Like everybody's smiling right now. Babies. We had a baby parade yesterday, and that should prompt, I think we have some photos of our baby parade. So we literally had babies on display, celebrating this kind of historic program we were coming around. Look at the baby, we had babies, and that's so good. And we had a marching band. The mayor was the grand marshal. We had American flags because we're stealing back patriotism. Because this is how we care for each other.
Some folks are done with the American flag anyway.
We're stealing it back.
They flying it upside down.
Oh, okay. That's true. That is true. So the stories, the images, we also unveiled a mural. There's art that's part of our project that's going on a city wall. We have music. So a lot of this work is about that narrative shifting work. But we were only able to make this possible because of a public-private partnership. And a big piece of that was the ability to leverage for the first time TANF dollars. And I need to give a shout out to my co-director here, Professor Luke Schaefer. Luke, raise your hand. So this was all Luke's work. So Luke is the kind of a national kind of leading poverty scholar, an author of so many books. And Luke has lots of wonderful relationships with folks at our state and at the national level, and taught me about TANF, which I knew very little about, just like I knew very little about water about a decade ago, but now I know a lot. But TANF, as you all know, is the Temporary Assistance for Needy Families program. It was created in 1996 as part of welfare reform, and it was this kind of work-first program, but really it's a slush fund. It's something that kind of states use to balance their budgets, and not much actually goes to people as cash assistance. In Michigan, before RxKids, only 6% of the TANF budget actually went to cash assistance. So we worked very closely with the state. They were wonderful partners and shared this different vision of what cash assistance could look like. Cash assistance is so stigmatized. Participants hate it. It's cumbersome. It's like, there's all these questions. It's not fun. And we presented a vision of how it can be inclusive and preventative and anti-racist and based on science. And they agreed. So TANF dollars were included in the state budget last year. And we are using a little known provision in TANF, which is my favorite thing in the world, called non-recurring short-term benefits, or NRSTs. Has anybody ever heard of NRSTs? It's amazing. NRSTs allow you to give 4 months of cash assistance during an acute economic crisis. And it could even be given to non-TANF recipients. And we defined pregnancy and childbirth as an acute economic crisis because it's the poorest time in people's lives. And ACF agreed, and so we're able to give 4 TANF payments. So TANF is covering the prenatal payment and the first 3 infant payments for lower income folks, and we're using Medicaid as a proxy. And then philanthropy dollars are sprinkled in to make it a universal program and to extend it to 12 months. Sprinkling in a little bit of philanthropy also allows us to protect public benefits. So this does not impact things like SNAP and WIC and Medicaid. So it is a beautiful kind of use of TANF. And we're so excited because this creates kind of this playbook of sustainability, but also replicability. Other states, other communities can do exactly what we're doing for a similar program.
So when you talk about the importance of framing and narrative and storytelling as part of this effort to move lawmakers, talk to me about the language of infant poverty. So as I shared earlier, a lot of my work these days is in the context of foster system. And I worry, having seen the brutality of essentially child snatching, because there's a sense of we must protect children, and then children are seen as somehow separate from their families, their communities, their parents. How do you talk about, use the framework of we all love babies because we all like babies, right? So I'm down, right? I'm also just down strategically for that. Plus, I love a baby. without doing that thing that then separates what is good for children from what is good for the families into which children are born.
Babies. So I'm still to this day a practicing pediatrician. We had a lovely field trip in Flint yesterday for some folks, and we had a 5-day-old that was there. That was part of this program. And when I am with a baby in the exam room and I'm throwing everything at that baby, especially since kind of the water crisis, we've really tried to build this model of recovery. So we're part of the Imagination Library program, Dolly Parton's program that mails books to every kid. We have a WIC office in my clinic. We have nutrition, services. We have trauma-informed care. The Flint registry that weaves together. The list goes on and on of all these things that we throw at our children to promote their health and development. But when I am holding a newborn in my hands and that wide-eyed baby is staring at me, and I know the zip code that they are born into, and I know the science of what it means to be born into and to grow up in poverty, it's devastating. And I feel that as a physician, like my hands are tied. I need something in my doctor's bag, in my toolkit, to be able to prescribe an antidote to that poverty. And I haven't had that. And I haven't had that for our babies in Flint. And we haven't had that for our babies in this country. Every minute that a baby is born, they are growing up in a hole that they can't get out of because of our embarrassing child poverty rates. It is embarrassing. Flint's child poverty rate is 69%. It is the highest child poverty rate in the state, and it's actually the highest child poverty rate in the nation. Okay? And the younger the family, the younger they are, the higher the rate of poverty. So we actually mapped out our city, and we're like, maybe we could just when we were developing RxKids, we're like, maybe we could just do it for the north side or the east side or the south side. But we mapped it out. There are poor kids everywhere. But the younger the family, there's it's like that poverty rate for under 5 is like 80 to 100%. Okay, that's not okay. That is not okay for us in the richest country in the history of the world to be okay with babies who are staring at us wide-eyed, just like any other baby, who have every potential in the world to grow up in those circumstances. So it's for the babies. So we talk babies. We say babies are cute. We love our babies, but our policies don't follow. We do not have policies in place. And we all saw it when we failed to renew the expanded child tax credit. We don't do what our babies and our children need. So we're going to start with babies because, once again, these pregnant moms and babies, this is the most important time. But our goal is that this is just the beginning and that we expand from babies. But once again, that investment in infants, the prevention of infant poverty, the elimination, literally, Flint, we are on the path right now because of RxKids. So RxKids launched in January. Over 700 mamas and babies are enrolled. We're at about a 90% saturation in the community. Almost everybody who should be in the program is in the program. We've prescribed about $1.6 million already. We are already on the path to eliminating infant poverty in the city with the highest child poverty rate for the babies.
Can you do that without simultaneously leading some policymakers to think that the prescription is removal of babies and plopping them into families with income? Because we've seen that as well. I mean, this is like the response in the reproductive justice, I'll adopt your baby. No, ma'am, that is not what you're talking about.
I'm glad that you mentioned child welfare and foster care placement. So do you guys know when most children are involved in child welfare system, what age is that? Is it when they're older kids? Is it?
I would have guessed 6.
6? Yeah.
I would have guessed 6.
So the peak age of child welfare involvement, which is when you have investigations and foster care placements, the rates of abuse and neglect, is 0 to 1. So it's more than double the rate of any other age. So the peak age of child welfare involvement, which is a massive societal cost, and not even what happens to that children and that family, is infancy. Do you know why it is that high in that age group? So failure to thrive, so the nutritional issues maybe, just got mandatory reporting. So poverty. So the number one reason that is so high in that age group is because of neglect. And neglect is, you call on the family because their utilities are off, because the kid looks dirty, because they're clothes, they're missing school. It's because of poverty. It is poverty is the number one reason that we take children from their homes. And then we pay as a society so much for this system that takes children from their homes. What if we use that money and gave it to families to keep children in their homes? So that is one of the biggest outcomes we anticipate seeing with RxKids. We have access to all the state's child welfare data almost in real time. So we are going to be able to see the impact that RxKids has on child welfare. You met Tegan. That is very much her story. Because of RxKids showing that she had income, she was able to get custody back of her 2 older children. So that is an example of its impact.
I love this because guaranteed you've taken us on a journey. And we're to a point in the journey where we're over time, but I'm going to ask one last question. But you've taken us on this journey of both the identification of problems, thinking about who's an expert, right? What does it mean to be a city in crisis, right? As is identified by others, and then to be in this place, which is in part about having this prescription. And it's a prescription, right, for child poverty. It's a prescription around addressing the involvement of the welfare state, right? So many things. It also, before we go, because it is on all people's minds, that we are in this political moment where there is at least a conversation about democracy. And it certainly feels to me like part of this is also a democracy prescription, that there is something happening in the work that you are doing and have been doing that is about the great project in self-governance. Can you speak to that?
Oh, thank you. I'm so glad we're going over time to talk about this. So we talked a little bit about democracy, and this program, I feel, is a way to rebuild democracy, a way to restore democracy, a way to reimagine that social contract, to rebuild trust in government and in institutions. And we're actually going to be measuring all that. We have questions on our survey about trust and civic engagement. We're going to link to voter files. We hope to see an increase in civic engagement. This week, we mailed every newborn in Flint a welcome bundle. We have a relationship with Vital Records, which is the birth certificate data in the state, so we know about every baby born in Flint. That's how we know our denominator. They were just mailed 2 really cute onesies. One of them says like best baby ever. The other one says love. There's a personalized card in there that says like welcome to the world, Samantha. We're so happy you're here. Sign up for the program if you haven't. And in that bundle, in that welcome card, is a note from the governor of Michigan, Governor Whitmer, who you'll get to enjoy seeing later today. And she has a card in there to every newborn that says, welcome to the state, our newest Michigander. We are so happy you are here, and we can't wait to see what you become. So this is all part of that work to restore democracy, to restore trust in government, but ultimately to reimagine that social contract, because this is how we should be caring for each other.
And I lied, because since you did that, I have to now, I'm sorry, because you went not only to democracy, but to trust institutions, and I have to do this very last one. I'm so sorry. Someone is very angry somewhere.
They're totally going to yell at us.
Well, I've blown through commercial breaks from some of the best. It's fine. One of the reasons we don't trust institutions is because we are not given an opportunity to see people learn in public spaces, to fail and get better and be able to say, I got some of this wrong. The moment for me that you were just talking, where I'm like holding back the tears because they did the nice makeup, was mommy's telling you something wrong with my water. And you're like, no, it's okay. Mix it with it. Mix the formula with it, right? Right? And then you're like thinking, what are you getting wrong right now? That with more time, more resources, more that you could get better at? And maybe not on purpose, but what mistake have you made that you would, just as a community trust building process?
That's a great question. I wish I would have done this work earlier. I have built so many programs and raised so many money and done so many different things, which, when you think about them, are paternalistic. You know, sign up for this, go to this parenting class, do this, do that, do this. I wish I would have championed this earlier, but I think it took seeing the success of the expanded child tax credit to realize that I don't have to shrug my shoulders anymore, and that we can do this. That this is not an impossible thing. That we can do this work. So I wish I wouldn't have. All those things are important, but they really kind of ask our children and families to be more resilient, and that's not the answer. Our movement really needs to be about building resilient communities and a resilient society, so kids and families can just be kids and families, and not asking them to do more.
Thank you.
Thank you. Amazing. Thank you. Thank you.